A chaplain is a person that provides emotional and spiritual support to people in need. In the hospital, it's people who are patients, their families, and also the staff. And chaplains go to a patient, a family member, or staff with no agenda. It's not about our religion. It's not about things that we believe. And it's really not always about what the patient believes, because we go to people who have no faith as well. And really what we do is we journey with them during a very difficult time in their lives. And we meet them where they are. We don't bring anything into the room. It's just exactly where they are and what they need from us. And so that is an honor and it's a privilege to be a chaplain. And then, of course, people need to be taught how to do that. And so what better way to teach them than to teach them in the hospital under supervision of other chaplains. And so our chaplain course is there for people who want to be hospital chaplains, but it's also there for people who just want to be very effective spiritual care providers. The program that we have at several of our hospitals in Nuvance Health is called CPE, and that stands for Clinical Pastoral Education. And in a nutshell, CPE helps you to learn to be an effective spiritual care provider. And you will be doing this in an interfaith context. And so the people that we accept in the program come from all religions, and that's really exciting because if you're in seminary, you're often with people who have your own faith. But in CPE, you could be studying with someone who's Muslim, someone who's Buddhist, someone who's Hindu, variety of different Christians of all denominations. So it's a very diverse group that you get for your peer group. The course is always the same. It's 400 hours, 100 educational hours, and 300 clinical hours. In our system, the clinical hours are spent visiting patients in our hospitals, and we present to the patients as interfaith ministers. So we're really not there to talk about our own faith. We're there to be present to the patient, whatever their needs are, to just be present and to listen to them and to provide them with emotional and spiritual care. We have a 20-week course that's offered at Norwalk Hospital. It's offered in the fall and it's offered in the spring. So what you do with the 20-week course is you divide up the 400 hours effectively into the 20 weeks. So in that context, 1 day a week, you'll be studying the educational time with your peer group for 5 hours, and the rest of the time, about 13 to 15 hours, you're going to be visiting patients. In the summertime, we have an intensive course, CPE intensive course, and that is 10 weeks for the course, and then that way, because of the 400 hours, you would be doing 40 hours a week. So you would be having then double the amount of educational time per week, so 10 hours per week, and then 30 hours visiting patients. At Vassar Brothers, we're doing a longer extended unit. And so that's a unit that would start, say, typically in October, and it would go to May. And so then you would be dividing up the 400 hours over, say, about 30 weeks. And so in that particular form of doing it, you're going to be meeting for less educational time per week, and then of course your clinical time is also going to be less. And that particular form of it is really good for people who may have, some of them may have full-time jobs and they're able to fit it in, and some of them just need to have that more part-time version for whatever reason. And one of the newest things we have to our CPE program at Nuvance House is a CPE Residency, and that's super exciting. So if you have one unit or course of CPE, you would be eligible to apply for our residency program at Danbury Hospital. And during the residency program, you're going to be working full-time, 40 hours a week for 12 months. And in the course of that year, you're going to be able to get 3 more units of CPE. And you're sort of wondering, well, why? What's the magic number 3? Well, you have 1 unit going into it, and then you get 3 units during the course of the program, so that ends up with 4 units. And to become a board-certified chaplain, you need 4 units of CPE to apply for your board certification. So the residency is really preparing people to be professional chaplains.
It was transformative, that I've really personally found it very empowering. I did find it integrative. That's actually, I think, one of the the goals, right? The learning outcomes of CPE is to be integrated in your personhood, and I would definitely say that I feel more integrated in my personhood. So yes, it was definitely worthwhile.